For an osteotomy, we'd be expecting them to initially to rest, because that is the most important thing, to get the swelling down, to let the effects of the surgery subside.
Swelling is your key objective, basically. Everybody who has one of these operations, be it arthroscopy, be it ACL, be it osteotomy, will get swelling after their operation. You need to spend some time to make sure that your leg recovers and settles down. So elevation has a massive part to play. Don't expect to get back to your normal activities immediately.
So take it easy for the first few days and your recovery will be all the more successful. Remember, keep your leg elevated as much as possible for the first few days. Use ice as recommended by your physio to reduce the swelling. Keep your wound and dressing dry for 2 to 3 days. And do not drive until your medical team have given you clearance to do so. This may be up to 6 weeks after surgery.
With the modern osteotomies and the plates that we fix them with, they're very robust, and we're actually happy for patients to weight bear from the off, much as they do with joint replacement. However, most patients are quite sore afterwards and don't fully weight bear for a few days or 2 or 3 weeks afterwards, so they're using crutches for some support.
So, most people will be able to start putting some weight through the leg straight away, and most patients can fully weight bear by 3 to 4 weeks. Your surgeon and physiotherapist will discuss this with you on an individual basis.
I've met quite a few patients who do too much to start off with. Once that swelling builds up, it's much harder to shift it. So prevention is definitely better than the cure. So by trying to slow down the amount of swelling that accumulates, you're certainly going to speed up your whole recovery process.
Obviously, everyone's aiming for a successful recovery from your very first days at home. But sometimes things don't go as planned. You should be aware of these warning signs.
So anything where the knee is still painful or pain is increasing, if that happens, we're beginning to worry that there's something somewhat awry. If the knee is swollen, hot, red, tender, the patient feels what we call systemically unwell. They feel fevery, as if they've got a cold or something, and shivery. We worry about infection. So it's really increasing swelling, increasing pain, increasing redness, and feeling unwell. Yes, that's when we want to see them. We run an open access policy here. You don't have to necessarily go through your doctor. Obviously, that's usually the first port of call, but most of us will be very happy for the patient to contact us directly, and we'll see them as quickly as we can.
More information and contact details for the medical team at the hospital can be found in the help section of the website.